Hello, everyone, and welcome to another episode of the Overcoming Chronic Illness podcast. My name is Dr. Brian Rade, and I'm a naturopathic doctor. And today I am joined by Dr. Diane Mueller. Dr. Mueller is a fellow naturopathic doctor, and she was actually on the podcast a year and a half, maybe 2 years ago. We were talking about Lyme disease and other chronic ailments, and Dr. Mueller's been specializing in that area for quite a while. And we had a great chat, and I've interviewed a lot of folks on my podcast, and and usually I'm meeting them for the first time. And man, oh man, just I really resonated with that Dr. Mueller. I think we're cut from a similar cloth, similar practice philosophy. So we had a great chat, and it was really nice meeting her. And so she reached out to me a few months ago, letting me know that she had published a book, and she asked if I would like to talk to her about it on my podcast. And I said, sounds great. But then she told me what the topic of the book was, and I said, well. Um, I don't know how we're going to work this into my podcast because it's a little off topic. But then we back and forth about it, and we figured a way to work it into the podcast. So the book is all about sexual health and libido issues. And when she told me about the topic, I thought like, well, sexual health and libido are really important for everyone. Like it's a facet of our health. It's very important. But I didn't really see how it would interplay or work itself into a podcast about overcoming chronic illness. But she indicated it's like folks who are dealing with complex chronic illness oftentimes have a lot of issues with their sexual health and libido. And even though they may have, other maybe more pressing symptoms or more pressing issues going on, sexual health and libido are important, especially if they're having, health issues for, months and years and sometimes decades on end. It's like, well, man, oh man, it's not necessarily a healthy option or an optimal option to say like, oh, I'll wait till I'm better and then I'll work on my libido and sexual health if it's going to be a 1 year, 2 year, 3 year, 5 year, 10 year, 15 year journey. So I have no idea what we're going to talk about. This is kind of an exciting little, like, I don't know, a little bit more of like an Easter egg type episode for me because I know it's going to be good because I have confidence in Dr. Mueller and the information she's going to bring in, but I'm just not really sure where the conversation is going to take us. So I am going to pause the recording here. I'll be joined by Dr. Mueller in just a moment, and we're gonna see what happens. All right, everyone. Well, I'm now back with Dr. Mueller. Dr. Mueller, thanks so much for chatting with me again.
Oh, thank you, Dr. Rade. It's a pleasure to be back.
I'm excited about this conversation. So, just in case folks didn't catch our first episode together, would you mind just giving folks a quick background on who you are, where you practice, and then we'll go from there.
Yeah, well, what we talked about in our first episode was Lyme disease. So, I'm Dr. Diane Mueller, and one of my specialties, well, we're talking about another area of expertise of mine today, but one of my specialties is Lyme and mold illness. I'm based in Colorado, but we are licensed in 6 states between my MD and myself. And a lot of my work in that is really similar to you. It's really working with people with complicated chronic diseases, oftentimes who have seen dozens of practitioners and don't know what's wrong. And turns out in many cases to be Lyme, Bartonella, Babesia, mold illness, and all of these amazing things to find. And amazing not because they're great or easy, but amazing because they explain everything. So that's a huge part of my Lyme. And then my second, practice that we're talking about today is an education-based practice. So in my second practice, it's not direct patient care; it's all through teaching. And it's my libido doc. And many times people are like, well, this seems like a switch. And I didn't switch, I am doing both. But when we actually look, and you and I as naturopaths, we know that the foundational root causes oftentimes of things overlap. And what became apparent to me in my Lyme and mold practice was how much these types of diseases, in many ways, are interrelational diseases. And what I mean by that is interrelational, not libido and Lyme. I mean, there's some truth there, but interrelational mean the couple is involved because when one person is that sick, the spouse, their partner, oftentimes has a relational impact too. They're not getting the time, the care, all these things. And I started seeing a lot of times where people were having spouses or partners just not understand, MCAS patients, and their partners were getting frustrated with their reactivity, not getting out of bed, not being able to participate. And it, has sometimes led to really deconstructing the relationship. And so that was one of many. I have many reasons for starting this other business, but that was one of them, is really helping to support couples through that, but also when they're kind of on the other side of the Lyme and the mold, to really repair the relationship, as many times it has really got put on the back burner just out of survival.
Okay, well, I'm excited to dive in because, yeah, and sort of interesting how we, kind of our practices have some parallels because in the last few years, I've really gone down the rabbit hole of like getting into nervous system regulation work with my patients. We started doing brain mapping. We've been doing neurofeedback with patients. I've started doing IFS therapy with some patients. Went down the rabbit hole of EMDR, like just because so many folks, of course, with complex chronic illness, so many nervous system dysregulation challenges, amygdala dysfunction. Like, just there's this whole, I love like the primal trust system, referring people to that if they want to kind of DIY it a bit more themselves. And so, yeah, just kind of seeing those overlaps and how it's so important not to just be honed in on like the microbe and the mitochondria and all these things that are super important, but yeah, there's more to a person than just their the infection that they're dealing with or what have you. So I love what I'm picking up what you're putting down, and yeah, a bunch of questions for you. So if you're ready to go, let's jump into it.
I'm ready. Let's
Okay,
go.
beautiful. Um, so let's see where to begin. Maybe because you published a book recently, and so maybe you could tell us about the book if you don't mind. And yeah, your black background. There we go. Yeah.
There we
So
go. I got it.
you hold up again. It's, yeah, I think want
Want it. Yeah.
beautiful. And we'll like link to the book and wherever, I'm sure people can buy it everywhere. I'm assuming like all the places
Yes.
people buy
Yeah.
books.
All the major platforms.
Great. So maybe you could just tell us about the book so we can have kind of a sense of that, and then I'll start breaking into my myriad questions for you if that's okay.
Yeah, perfect. So the book is actually part one of a three-part series, because when I've looked at libido and sex drive and really tried to deconstruct root causes and looked at research on this, what I've come up with is there's three major pillars for the root cause. So one being personal. So that's everything that's kind of medical. The second being, I'm sorry, the one being physical. That's everything medical. The second is personal, meaning everything going on kind of internally, like, do we have shame? Do we have guilt? Do we even know our own pleasure? Can we stay present during sex? And then the third being interpersonal, being like, how do we relate to our partner? How's our communication? Are we able to explore with our partner? Those kind of things. So this book really is all about the first pillar, which is the physical. I'm like losing my lighting here. I'm gonna get my lighting a little
You're
better so I don't
structurally there.
go into the ethers there. I'm like disappearing into the world. Okay, I'm back. So the first pillar is the physical root causes. And so that's the things that we think about from a medical perspective. So when we get into the physical root causes of low drive, there's the obvious stuff that a lot of people have heard of are sex hormones, stress, circulation, right? So those are some of the easy ones, thyroid. But then we also see direct relationships to things like mold and Lyme and anything that's really a neuroinflammatory process. So that can be a big driver of low libido, and we can talk about that. And even things like pelvic floor dysfunction. It's very interesting in the sexual wellness world. One of the things that I often find is that there's certain root causes that a lot of people are like, oh, well, these are the root causes that happen to men, and these are the root causes that happen to women. But it manifests differently, but the root causes really are the same. So, for example, another thing I talk about in the book is pelvic floor health. And, we have 14 muscles that make up the base of our pelvic floor, holding our abdominal organs into place. And a lot of women are aware of this because after pregnancy, they're taught to do Kegels, right? And that's a largely what's said about the pelvic floor. But what we also see is a weak or dysfunctional pelvic floor is directly related to erectile dysfunction in men. And so when we're actually looking at these root causes, it's like, even though that's not talked about as much, we really need to work on that root cause as well. So we go into that. We also talk in the book about orgasm and about really understanding the anatomy and the physiology of orgasm. Because one of the things that is actually driving women oftentimes away from being sexually interested is they are not fully engaging their tissue. Like what I learned post naturopathic medical school around even the anatomy of the clitoris for information is so much different than I was personally taught in naturopathic school. So it's such a bigger organ than we really than I really realized, and a lot of people are not engaging it in a way that is engorging the tissue so sex doesn't hurt, in a way that's bringing more pleasure so that the woman actually has better orgasms and therefore is more enticed to enjoy sex. So we talk about that perspective as well, because there's that physical component. And then, of course, it's action packed with solutions and what to do to fix everything.
Cool. So, so the Want It book is more around the physical aspect, being
Correct.
part one of
Part
three.
one. And part two will be out soon. It's with the editor now. So I don't know exactly when, but definitely 2026. And then part three will be late 2026 or early part of 27.
Okay, cool.
Yeah.
So, and then in your practice, given that you're writing these three books, so you when you're working with patients, then you work on all three aspects. It's just the books can only come out in a certain sequence because it takes forever to put a book together.
That for one. And also, I decided to release it in three parts versus like waiting to release it and putting it all together. Because I don't know about you, but one of the things that I've seen in my practice is like when I give people too many things, it's like a paralysis by analysis type of thing is
Mhm.
then nobody takes action because it's like, where do I even start? This is so much. So, it's like we know as naturopaths, like the biggest thing that gets people results is action and change.
Mm.
And so I intentionally did that. So people, even when all three are out, like, hopefully our people are going to like read one, put it into action, move on versus like I have the fire hose of everything. And where do I even start? So it was also intentionally done that way because of just wanting to do it in a way that I felt was going to create the most change for people.
Gotcha. Okay.
Yeah.
Great. Um, so would you maybe be able to give us like a little example, like maybe one large example or a few little examples of like how some real life examples of how like this has kind of played out for folks, like how it's been helpful, like whether it's working on all three levels or just on a physical level, if you want to keep it to that, whatever your preference is.
Yeah, I mean, there's a lot of things I could say here. So keeping this succinct is probably the biggest challenge of this question. It's simple things, right? So it's like very interesting when it comes to sex and intimacy, how many times people have just decided this is not interesting to us just for whatever reason. It's gotten boring, we're overwhelmed, we're overworked, we have chronic illness. I've seen situations where people have not had sex in years and all of a sudden they're having sex again. I've seen situations where people have never talked about it. Like I'm thinking of one woman that's like never talked about it, with her husband, super bored. And then all of a sudden they're talking about all these novel things they can do and bringing fantasy in and that sort of thing. And it's interesting too, from a standpoint also of like self regulation and cortisol. And, cortisol gets such press these days. Some of it accurate, some of it I think kind of misleading. But people think of cortisol, and the first thing people think of, is probably belly fat, right? And we know cortisol, the stress hormone, gets so out of balance when people have chronic illness, when they have sexual dysfunction. But it's very interesting that when we look at the body's ability to re regulate cortisol, one of the best ways to re regulate cortisol is actually through the production of oxytocin. And so when people are having more regular sex and they're getting more and more oxytocin, when they're working on their orgasm, improving not just quantity, but the quality really matters. So you get more oxytocin release. What oxytocin will actually do is lower that cortisol, right? And so it'll bring somebody, if they're in a hypercortisol state, back into balance. Also interesting, Dr. Rade, that when we look and we see like cortisol in other ways. I'm sorry, oxytocin in other ways, such as 20-second hugs or 6-second kisses, which you can read about online. And some of those things can raise oxytocin in the blood 30 to 50%, which sounds really cool until you realize that an orgasm raises oxytocin 500%. So, in truth, I've never done anything that I would consider a true isolated study of orgasms and cortisol. There's so many different things we're always working on at one time with naturopaths. So I don't have like a clinical study that's like, okay, everything else was the same and we are, somebody's working on this and all of a sudden their cortisol is more balanced. But I can tell you that when people implement this, that when they're really looking at improving this, we can see their experience of stress coming down in their lives.
Hmm.
Yeah.
I have a few questions for you
Yeah.
that branch off of that, but I mean the one question is, um, so just when we talk when people talk about orgasm, there's kind of like sort of the traditional definition of an orgasm, if you will, and I understand my understanding of it, at least by proxy, is that with women there's like different subtypes of orgasms that they can have depending on what tissue is being stimulated. I believe a common belief is that like some women can like only have clitoral orgasms, or maybe even more limiting belief is some women believe they can't have orgasms because they never had one before, which is I mean, not passing judgment or anything. It just strikes me as being very sad. And my understanding is not true. That just maybe just it's an education piece that's missing there. So your book would be very helpful for those individuals who might believe that. So with women, in terms of their ability to have like different types of orgasms, and then with men, it seems to be like generally like there's just kind of one type of male orgasm. And I guess maybe two-part question. So one is, does your book talk about is there more than one type of male orgasm? And are there do you talk at all about non-ejaculatory orgasms? Because as men hit a certain age, they might be listening to this thinking like, that's all well and good, but like I'm not in my 20s anymore, and I'm in my 60s, and like, oh boy, like that's and maybe some men are like, yes, that's great, and others maybe are going to be. I just think about Chinese medicine class where it's like sort of there's a folks just for interest for folks. Dr. Mueller, you'll obviously know this, but for interest, like there are these literal like tables where it's like at a certain age groups where it's like, oh, during this age to this age, like it's healthy to have for men to ejaculate, X number of times a week, and then it gets a little bit lower over time. Where I think by the time you're in your 80s, it's like once a year or something like that. So anyways, could you riff on the male orgasm piece of things, please?
Yeah, love the question. This is all actually covered in book two. We go more into that because, and I put it in book two because a lot of how we learn how to do this is through working on oneself. So, and what you're talking about for our listeners in Chinese medicine, we call Jing. It's kind of like this essence, like our life essence. And there's a thought that our life essence is really contained in a huge amount in our sexual secretions. And men, because there's ejaculate, that there's this thought of, wow, this life essence is going away. And it is interesting, right? And like talking to my partner about this, one of the things that he shared is that like in his 20s, right, that when he would ejaculate, it would almost be this almost like, okay, there's so much intensity, and it just kind of like releases like some of that tension. And now he can find that, okay, well, too frequent of ejaculation and maybe he's feeling a little fatigued, right? So that's a level of how that can manifest. But a lot of how we really work with this is through learning our own body and learning our own system. So the process of edging is a really big one. And I kind of combine that also with since I'm also a, Chinese medicine doc, to combine that with a lot of like the Taoist Tantra ideas and some of the Chinese medicine ideas of like working with re-regulating the energy channels in our body. So for men, to answer your question, like there are different types of orgasms. There's the non-ejaculatory orgasms. There's also prostate orgasms where we're actually getting a internal stimulation through the anus, and that can lead to a different type of orgasm in man. So really, I would like, kind of these few different types of orgasms. But one of the things that will happen with more of these non-ejaculatory orgasms is they will oftentimes feel, at least, in men I talk to, feel different time to time versus like when I talk to men about it, it's like, okay, well, your standard penile orgasm is, it might be more intense or less intense, but a lot of times people, the way they describe it around like electrical or, these types of sensations, it's like there's a level of like consistency. There's a little more flexibility in the non-ejaculatory orgasms and how they feel. At least that's what men have told me. And a lot of that is done through the process of edging, which can work really well with partners, but it oftentimes is practiced best alone. And that's where, and I give the scale and pictures of this in part 2 of my book. But if we have like an arousal scale with 1 being not aroused at all and 10 being climax, then when people get to that feeling of 7 or 8, where it's like, okay, I'm not there yet, that's when we actually start working with the concept of edging. And we do that through voice. We do that through different sounds that we can actually make and change things. We can do this with changing rate or rhythm. We do this with clenching and squeezing the pelvic muscle. The perineum spot, which in Chinese medicine is on our what's known as our conception vessel, the channel that runs up the front of our body, that has been shown to be kind of like a huge break for the orgasm as well, or for the ejaculation. So if men press on that spot, sometimes that can pull them back. But a lot of it is like practicing first yourself and then combining that in partner play, because the female actually can play a big role in that too. How much she contracts her body, how much she is. I'm like, really, I'm
I love your
having a
special
good time.
effects
Like,
there, Dr.
yeah,
Mueller.
I love my special effects. They're very mystical. How much she's like contracting her body or contracting her own pelvic floor muscles. And then just to also name what you said earlier, because I think it's so important, the idea of women that have a difficult time orgasming or have never orgasmed, which surveys vary on this, but it could impact, like there could be up to like 15% of women that have actually never experienced an orgasm. So it's fairly common, right? This is not, some strange, rare thing. And the biggest thing I tell women is like, every single human body is capable of that. So just because it's never happened doesn't mean it's not going to. But a lot for her of how she stays, interested in all this, it's not the idea of losing that jing, of losing that essence, like it's talked about in Chinese medicine for men. But for women, it's a lot more about really understanding, because she oftentimes can find that the quality goes down with age, that she becomes more numb, or that there's pelvic pain. So a lot of it is keeping her muscles really elastic, like really stretchy in a healthy way, like other muscles in her body, but also in learning her own pleasure zones, that so she can actually guide herself and then guide her partner, like, oh yeah, like at this point in my life, I need a little more of this, a little more of that. Like another thing that's not talked about is like when we're talking about different orgasms for women, G spot orgasms is a well known thing in the sexual space, well known. It's really a zone, not a spot. And we can actually even get scar tissue over this area. Some of it's through pregnancy. We don't know why else it forms. But if that's the case, like a woman's probably not going to experience penetrative orgasms very well, which only happen to 33% or so of women to begin with. But if there's scar tissue there, unless the penetration's all the way to her cervix and she's getting orgasms that way, it's probably not going to be that pleasurable. We can heal that scar tissue, but in the meantime, she needs to understand that her body has changed and really work on some of these other types of orgasms, fully taking advantage or of like the full expression of the clitoral orgasm, for example, in order to actually experience pleasure.
So, every time you talk, Dr. Mueller, I have more questions. But anyways, we're gonna get through them as best we can here. So I have a couple in the queue here, but one that just kind of sprang to mind. So, this is a topic that I've thought about a fair bit, and it's something where I'm wondering if you can kind of riff on this a little bit, because kind of looking at optimal health for folks, whether they're suffering from complex chronic illness or not. And so far, everything you said applies to like just adult humans, just humans, complex chronic illness or not, which is good. It's nice to have broadly applicable podcast topics. This is good. So just I guess am I opinion at least, and I'd be curious to hear your opinion on this, and if you could riff on this a bit. Um, really to have like an optimal state of health. It's and bearing in mind, I would define optimal state of health as being, mind, body, spirit, the whole kit, emotional, tied in with that, like the whole kit and caboodle. To really feel like optimally healthy, having fulfilling relationships in our lives, I think is very important. And if we are, let's just say for argument's sake, to keep it simple, if we're in, like a monogamous relationship, having like a good connection with our partner, being able to, share our feelings and feel supported and all these good things, very important. And then having a good sexual relationship, so helpful, so important as well. I mean, I suppose one could make the argument that you could have a very good, fully fulfilling relationship without sexual connection, I suppose. Like, I'm not here to pass judgment or say whether that's true or not, but let's just say, for argument's sake, that for most people, having a good sexual relationship is part of that. So what I'm hearing you say, like, talking about kind of like fleshing out like different, orgasm types and sort of to kind of optimizing the sexual experience, shall we say, like for both members in a relationship, like in a sexual relationship. Um, it seems to me that dovetailing on some of the things you said, like over time, like, some folks can get kind of like bored, maybe with men, like if say like erectile function is kind of going down because their pelvic floor muscles are weaker, or maybe like it's, kind of tying in like the physical, but also the psychological aspect where maybe if, say, we'll just for argument's sake, just talk about heteronormative relationships just to keep it somewhat on track with this very winding question that I'm ultimately getting to. So if, maybe like, the woman's not really getting as much pleasure out of things, so then she's not as interested in having sex, and then the man's kind of like, well, he's getting a bit older, and so his libido's maybe kind of, his hormones are dropping a bit, his pelvic floor is getting a bit weaker, so maybe, he's not as interested, so then they're kind of like starting to drift apart, sexually to some extent. It seems like with this, like where if by exploring the shall we say like the full menu of orgasm options and sexual pleasure options like for both man and woman, and of course this would apply to non-heteronormative relationships too, but like for both partners, shall I say, it just seems to me like this could be like incredibly important for the optimal health of a couple, and then by proxy, really important for the optimal health of each member of that couple as well. So could you kind of share your opinion on that idea where it's like how important is like optimizing the sexual relationship for overall, say, couple health and individual health in that couple?
Oh, 100%. I mean, it's a huge motivator for why, many motivators for why I have the passion project, really, is what this libido doc project is about. But we talk so much as holistic healers. We talk so much around how much are you moving? Are you working on your nervous system? Are you drinking enough water? What is your diet like? Are you consuming toxins, right? So there's so many areas we're biohacking sleep these days, and we're wearing our devices. We're getting our 10,000 steps. We're really talking about all these areas of what do we need to do lifestyle wise for general wellness and just for kind of that foundation. And sex is one of the things that I feel very strongly is actually missing from the conversation of what do we need to do to really keep our whole system well. And I think it's missing in part because it's obviously a kind of a taboo topic. People don't know how to talk about it. When people think about talking about it automatically, or, think about hacking it and learning techniques or whatever, everybody's mind typically goes to porn. And I think there's just not a lot of options out here of like, how do we have these conversations about a very intimate topic and keep it professional?
Mm.
And so that's a lot of what my work is about. And if we look at kind of riff off your question here, if we look at certain things, there was a study published recently. You may have seen this. It was I think about a 75-year long longitudinal study done by Harvard,
Oh.
and it was looking at, yeah, long study, and it was looking at all these things I mentioned, like, and it was the question was, what is the most important thing for longevity, but not longevity just for longevity's sake, longevity with happiness. And so it looked at everything I talked about and more, all the basics: food, water, movement, sleep, et cetera, et cetera. And actually, what it found was the number one thing that led to not only longevity, but quality with that longevity was our relationships. And it wasn't talking just about, sex and our intimate relationship. It was talking about all relationships. But usually, when we're with a primary partner, that person is our number one relationship in life. So to me, I look at that and I say, oh, yeah, there is a direct relationship here with happiness and longevity and the quality of all of our relationships, but in particular, that primary partner. So then if we look at other studies and we say, okay, well, of all of these couples that were surveyed, how often are they having sex in relationship to how happy they are in their relationship? And with that survey, and there's been a couple like this, what they have shown is that the happiest couples are having sex on average once a week or more. But what the surveys have concluded is that from a standpoint of relationship happiness, more frequent sex has other health benefits. So we can, like we can dissect that. But from a relationship standpoint, beyond that once a week could lead to other health benefits, but may not do anything from improving the quality of the relationship. Like that once a week seemed to be the minimum directed at the conversation of happiness. So, I think it's like directly related. And then when we even look at, okay, well, chemically, what's happening, and we see, okay, well, oxytocin helps to lower cortisol. And I personally believe that God, spirit, universe, whatever anybody wants to call that force, gave us the gift of pleasure, the gift of sexual pleasure, in part to keep us balanced. Because when we look at, what I said around oxytocin being raised 500 times in the blood with orgasm, as compared to other ways of raising oxytocin. And we look at the direct impact on cortisol. And then we look at, okay, well, if cortisol's too high, we see a decline in thyroid, we see a decline in estrogen, we see a decline in testosterone. There's even a study I saw on oxytocin building bone and actually stimulating osteoblasts, our bone building cells. So when we look at all the mechanisms with oxytocin, I really feel that sexual pleasure not only is about relationships, but really is this about this creating, self-producing these chemicals. It's also really interesting to me, like when we look at the body and we look at a lot of our hormonal system is set up on our negative feedback loop. So for our listeners that don't understand that, what that means is that like thyroid, if we have our brain sending a signal to thyroid and the brain says, oh, you don't have enough thyroid hormone, the brain sends the signal and the thyroid hears it. And if everything's working correctly, thyroid goes up and then thyroid sends a signal back to the brain that says, shut off the cycle. Now we have enough. So it's negative feedback. And a lot of hormones work that way, as we know, but oxytocin is one of the hormones in the body that actually works on a positive feedback loop, which is really interesting. So we get more oxytocin and the brain's like, well, that's yummy. That's balancing. I want more. So to me, that's just another sign of like telling us like how, like what a positive effect this can have on our body. Because as we start to do it and we get more in balance, the body's like, I think I want more and I think I want more. So truthfully, I think that this topic of sexual wellness is one of, and I'm sure we'll think about more as medicine evolves, but one of the key, most important missing things that is not being talked about yet enough when we're talking about the fundamentals of what keeps us well as humans and happy.
It's nice to be happy,
Yes.
yeah, it's a pretty easy sell, being happier. So if they say there's, let's say there's a couple listening right now, and they're kind of, one or both of them are thinking like, so, like we get along well, like, let's say we've been married for 20, 25, 30 years, we get along well, but like by golly, we are not having sex once a week. It's maybe like once every month, every 3 months, let's say. And yeah, but like we get along really well, we like each other a lot, like I don't know, we have kids or whatever. Like we have a good life and everything. And this, yeah, like we plan to grow old together. We're we beat the odds and we're not getting divorced. Like, oh, this is good. But like, man, it's not happening, every week. So, but they're thinking like, but maybe it could be better. And like I want to be happier and I want to be in that 75 years, study statistic. So um, they could read your book and start learning about some of the physical aspects of things. Stay tuned for the next one to kind of take it to the next level, the next one for the next level. They could also work with you depending on which state they live in. I'm just kind of thinking like if someone's thinking like, okay, I want more, like I want what she's talking about, like what would be the action steps that they might want to take if they're like, yeah, wanting to pursue things further.
Yeah, and you're actually describing a very classic couple that works with me. Like they deeply love each other and they're like very committed. And they're like, things are good, but like, wow, like maybe we could be, more good. Maybe we could be better, right? So that's really what draws people to my work a lot. I have so like my all my work at my libido doc, and people can always see me in my Lyme doc practice for libido stuff, and we can work on hormones and all the physical stuff. But my work at my libido doc really is educational. So I have all sorts of courses that can be done. The easiest one to start with is my 4 days to better sex course. And it's easy because it's 4 days. It's really succinct. It gives you a lot of content. But I really keep it like these are the most important steps to get you started. I also have a lot of free content on my website. So if people go to havehotsex.com, that'll redirect them to a page on my website where I have a ton of products with coupons, but also 8 different free downloadable guides, my books on there as well. And one guide, for example, is my yes, no, maybe checklist. And that's a really fun thing for long term couples because in it, you will find a lot of questions around sex, around like, well, are you interested in trying that? Are you interested in trying that? Like to bring some more, novelty back. But it also has questions more from like an emotional intimacy standpoint, for example. Like the idea with it is like, oh, to trigger kind of conversations that you haven't had to bring a little more spice and juiciness, even emotionally to your life. Because, after decades, couples generally feel like they know everything about each other. And so the idea is with these questions, it's to kind of generate the curiosity to start these conversations that are out of the box. So that's all of those things are really general, great place to start. If you want more of like the true step-by-step guidance, definitely jump into my 4 day, jumpstart course. Very, very affordable. And then if you want more free resources, that's a great place to start as well. And that's at again, havehotsex.com.
Okay.
Yeah.
Um, was it hard to get the URL, Diane?
I had to look at probably, I think I was going through on like the site, like maybe 50 of them before I found the one that, like, okay, this is the one.
Okay.
But I definitely am very into URLs that are easy to remember. MyLibidoDoc.com, MyLymeDoc.com. My Lyme doc, I have a free quiz that's getwellquiz.com.
Mhm.
So yes, it was a little bit of like brain power around like how am I putting these words together in a way that is available, but
Sure.
havehotsex.com was finally decided on and it was a pretty clear choice.
Yes, fair enough. Fair enough. Um, well, I know we only have a few minutes left because I have to get off to a school field trip. So I'm a little rushed for time today. But maybe just in the last few minutes here, I'm just wondering if you could quickly speak to sort of the I'm just wondering about folks. Okay, sorry, I'm trying to think of how to phrase this question. So, when folks start kind of doing more like exploratory work in this regard, whether they're, working with someone like you and like being directly guided, or they're working with some of the free resources you have, or, some of your courses or whatnot, um, I'm assuming that it's relatively common that folks will report or find that things will trigger them just due to like trauma history and things like that. My understanding, as you were touching on earlier, like, unfortunately, like a lot of folks, like men and women, maybe women more commonly than men. I don't know the stats or anything. Maybe you do. I don't know if they've been done, but just around like, genital numbness and things like that, whether that's due to like past, certain experiences or just, shame issues or whatever it happens to be. So I guess I'm just wondering, like, when I'm hearing everything you're saying, like this sounds awesome. Like this is something that I'd really wish for like, anyone to explore to like, really try to optimize that aspect of their health and their life. Um, But would you just as a I guess maybe like a word of caution or just a word of like heads up, like um, how often would you say that folks are going to find some triggers? Like this work is like not maybe like I'm sure many elements of this work would be very fun for most people, but there might be some challenges along the way. So could you speak a little bit to maybe like trauma triggers or just some of the more challenging aspects of doing this kind of enhancing work?
It's an important question, and I truly don't have a stat that I think could be accurate on like the frequency of it, but it is a very real thing. If you have any known, sexual trauma or otherwise, always, I do think always it's important to make sure that you are working with somebody that's trained as a therapist in one-on-one work. Would look at and one of my cautionary steps is if there is something where it's like, oh, I have this memory, and even if it's like, wow, something that a boyfriend, a girlfriend, a lover said to you one day around sex and you still are holding it, what is the level of intensity that you're feeling, in your body if you think about that? And if it's like, wow, it's really giving a lot of anxiety and you're kind of dissociating, oftentimes that's a really good time to talk to somebody. If it's like, wow, this is just giving me a little bit of like uncomfortable, but I can be with that, then that's usually safer. But judge, never push yourself too far here. Always watch your own feelings. Obviously, we don't have a lot of time here to go into this. I do address this in book two. I also address this in a lot of my courses and freebies and stuff. One of the one tip I'll give you in our limited time is if you are exploring things and you're feeling like, wow, you can't stay present and you're dissociating continually. And I'm not talking about like, oh, I'm thinking about like the fact that I didn't finish that at work and like, crap, I need to be thinking about my moment. That can happen. I'm talking about like, oh, I'm like, my brain is dissociating to something else, either a memory or just something else of my day, and I cannot get back into my body. I cannot feel it. Then usually we want to back up to like the maybe that last thing that we were doing where we can stay present in our body and breathe and do nervous system work and process from there. So there's a lot more I could say on this. It's obviously a very big question, but in the short of it, listen to your body. And also what I see, if this is done correctly and if this is with intention and if we're done honoring our nervous system and listening and working with our partner, there's actually amazing capacity to do this work and to heal those things as well.
That's very well said, Dr. Mueller. Um, just in the last minute or so that we have here, so you've mentioned a few of the websites, mentioned your courses, so I'll put links in the show notes. Are there any other places that folks can find you? Like, I can't remember offhand, are you on Instagram, YouTube? Where can folks find you otherwise?
All major social media. Usually the handle is at my libido doc, so super easy. And then you're also welcome to check out my podcast on libido. It's called Libido Lounge, and that is found on every major podcast platform.
Cool. Okay. Well, Dr. Mueller, thank you so much for taking the time to chat with me again today. I enjoyed this chat just as much as the last one, so I hope our paths can cross again. Maybe when the next book is out, we can have a repeat chat if you're up for it.
I would love that. Thank you for having me back. It's a pleasure to be with you again.
Okay. Thanks, Dr. Mueller, and thanks so much, everyone, for your attention. We hope this was of interest, and please stay tuned for the next episode.